Comprehensive assessment, take two. Okay, so I'm going to start by washing my hands. And I'm going to look up my patient medical record. So I'll see if they have any allergies, see what's ordered, their medical history, and their primary reason for their assessment. So I see that for their assessment today, I'm going to need my pen light and stethoscope. And so I'm going to clean my stethoscope with an alcohol prep pad. And I'm going to log off the computer and shut it down and head over to the patient. Okay, so I'm gonna knock, enter the room. Right away, I'm going to see inspect the environment, see if there's any safety concerns. I do not see any safety risks. I look at the patient. Their affect is in normal range. It matches their mood. I'm going to provide for privacy, and I'm going to wash my hands and introduce myself. Hello, my name is Saron. I am your nurse today. I am here to do an assessment. Can I just have your name and date of birth? And I'm going to compare that to what they have on the wristband. Their name and date of birth matches. And then I'm also going to log into their medical record, blah, 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 and their name and date of birth matches what's on their medical record. Okay, so again, the reason for your assessment today is just going to do just quick head-to-toe assessment, make sure everything's working okay. If you have any questions or any discomfort throughout the process, just let me know. But I'll be explaining what I'm doing as I go. So I'm going to raise the head of their bed up. Make sure it's still in view. Cool. So right off the bat, I am going to see, are you in any pain at the moment on a scale of 0 to 10? They're report having 0 out of 10 pain. I am then going to check their heart rate using their radial pulse. I'm going to count it for 1 full minute. Their heart rate is regular and 65 beats per minute. And while I'm still here, I'm going to start looking at their chest for respirations. And I'm going to count that for 1 full minute. Their respirations are regular, and I got 17 breaths in a minute. So then I'm going to start by inspecting their face. Their face is, the skin is a normal color for their race. Their face is symmetrical. I see no redness, no lumps, no bumps, no bruises. Hair is evenly distributed across the head. I'm going to go down. Their eyes are symmetrical. Their eyebrows, hair is evenly distributed there. They look even. And so then I'm going to pull out my pen light while I'm looking at her eyes, and I'm going to have you just look straight ahead. And okay, other side. Her pupils are equal, round, reactive to light with accommodation. And I'm going to have you follow my pen, please. Alright, eyes are able to follow the pen, no issues there. So then I'm going to, with my pen light, look at the mouth, one down. Oral mucosa is moist and pink. No broken teeth are present. No missing teeth. And no bad odor. So then I'm also going to check her ears. No signs of trauma around the ears, no redness, no excess cerumen, and that's going to be on both sides. So then I'm going to move down to her trachea. It is midline, no signs of trauma, no redness, no jugular vein or carotid artery distension bilaterally, and I'm going to have you swallow. Swallows, able to swallow. So then from there I'm going to move on down to her arms. So arms, upon inspection, are equal in color, which are normal for raised, no redness, no lump, bumps, lacerations, equal length. I'm going to inspect the fingernails, which are clean, no signs of discoloration, no discoloration bilaterally, no clubbing. Then I am going to have her do some range of motion. So if you can move your shoulders, shrug your shoulders, move your elbows, your wrists, and your fingers. She's able to, she has full range of motion bilaterally, and I'm going to push down on your shoulders. If you can shrug, perfect. And then I'm going to check the brachial pulse, +2 bounding, radial pulse, +2 bounding, brachial pulse, +2 bounding, and the radial pulse, +2 bounding, and that's bilaterally +2 bounding pulses for the radial and brachial pulses. And then I'm going to check the capillary refill. Capillary refill is less than 3 seconds. Capillary refill is less than 3 seconds bilaterally. So then I'm going to move to chest. So the skin is clear and even, chest expansion is even, regular rhythm, no signs of accessory muscles in use, normal color, skin is warm and dry. Now I'm going to auscultate her heart sounds. I'm going to start on the right side, second intercostal space. Left side, second intercostal space. left side, fourth intercostal space left of the sternal border. And then fifth intercostal space, mid-clavicular line. But I'm gonna listen to this to the apical pulse for 1 full minute. Heart sounds are all regular rhythm, regular strength at 65 beats per minute. So then I'm going to also take the lung sounds. I'm going to start above the clavicle. Then I'm going to have you take a deep breath every time I move the stethoscope. Take a deep breath. Okay, so now I'm going to move to the posterior side. Okay, moving on to the posterior side. Moving forward, please. Alright, so the back color looks clear and normal for race. No signs of bruising. No use of accessory muscles with breathing. Chest expansion is normal, equal bilaterally. So now I'm going to start oscillating the lung sounds in the back. So I'm going to start 3 inches away from C7. Alright, I'm going to try this again. So starting 3 inches away from C7. I'm going to end listening to my lung sounds at the mid-axillary line of the lower lobes. Okay. get you comfortable again. I'm going to lay you flat so I can do an assessment of your abdomen. There we go. Now lift up your gown. Okay, so upon inspection, the abdomen has a clear, even color, no redness, flat contour, no distension. So now I'm gonna oscillate. Starting at the right lower quadrant, and I hear active bowel sounds. I move to the left lower quadrant, active bowel sounds. Left upper quadrant, active bowel sounds. Right upper quadrant, active bowel sounds. So then I'm gonna palpate the abdomen. The skin is warm and dry. Please tell me if you feel any tenderness. So I'm gonna start right lower quadrant, left lower quadrant, left upper quadrant, and the right upper quadrant. And the patient reports no tenderness with palpation. So I'm gonna move to the lower extremities. So the skin color on the legs is normal for race. I see no lump bumps, no bruises, redness, more signs of trauma. Hair is evenly distributed on both legs. So I'm gonna have you have you, the patient, bend your knees, flex your ankles, wiggle your toes, and lift up your hips. Patient has full range of motions on lower extremities bilaterally. I am then going to inspect the toenails. I see no toenails are clear in color, no discoloration. So then I'm going to palpate the posterior tibial pulse, +2 bounding, +2 bounding, posterior tibial pulse bilaterally, and then dorsalis pedis on top of the foot, +2 bounding, +2 bounding, dorsalis pedis pulse bilaterally, and then I'm going to do capillary refill on the toes. So capillary refill is less than 3 seconds bilaterally on the lower extremities. Okay, that's the end of my assessment today. I'm going to lower the bed. Is there anything I can do for you? No. Here is your call light if you need anything. And that's the end.